Good morning, dear students. The next topic we move on to diet control for diabetes. Diabetes is often referred to as diabetes mellitus. It's a heterogeneous group of metabolic disease characterized by a state of chronic hyperglycemia. And this may be either because the body does not produce enough insulin. So this condition known as type 1 diabetes, or because cells do not respond to the insulin that is produced. This condition is known as type 2 diabetes. So this high blood sugar produces the classical symptoms of polyuria, that is frequent urination, polydipsia, increased thirst, and polyphagia, increased hunger. In a diabetic person, there is impaired metabolism of glucose in the body, which leads to the excess of glucose in blood and urine. So, our goal is to maintain normal blood glucose level. How this normal blood glucose level maintain in our body, in our blood? Because it happening with the help of insulin. Insulin is a peptide hormone produced by beta cells of the pancreatic islets. It is considered to be the main anabolic hormone of the body. It regulates the metabolism of carbohydrate, fats, and protein by promoting the absorption of glucose from the blood into liver, fat, and skeletal muscle cells. Is it diabetes, or yet how can we know about? If there is not enough insulin activity, or the body does not use the insulin effectively, so the body's blood glucose rises. This condition leads to known as chronic hyperglycemia or diabetes mellitus. And the chronic hyperglycemia leads to a number of other complications such as cardiovascular, renal, neurological, ocular, and other like recurrent infection. The prevalence of the disease in India among adults was found to be 2.4%, in rural and maybe 4 to 11.6% in urban dwellers. And the mechanism of insulin action in our body. At the time of low blood glucose in our body, the pancreas released glucagon by alpha cells of pancreas. In pancreas, the gland situated near the liver. This gland has two types of cells, alpha cells and beta cells, and the alpha cells control the production of glucagon, but beta cells control the production of insulin. At the time of low blood glucose in the blood, pancreas secrete glucagon from the alpha cells. Liver releases glucose into blood. At the time, liver releases glucose into blood. Achieve normal blood glucose level. The high blood glucose level in the bloodstream, automatically insulin released by beta cells of pancreas and the fat cells take in glucose from blood and to achieve normal blood glucose level. And this is the representation of type 2 diabetes and type 1 diabetes. Glucose in the blood stimulate pancreas. So the pancreas produce insulin. In the case of type 1 diabetes, the pancreas does not produce enough insulin. So in the bloodstream indicated elevated levels of glucose. But in the case of type 2 diabetes, the normal insulin was present in blood, but the insulin does not stimulate cells to take up glucose, the excess glucose present in the blood. So, insulin stimulate target cells. The target cells remove too little glucose from the blood. Blood glucose remains high. But in the case of type 2 diabetes, insulin does not stimulate cells to take up glucose. And this is the insulin production and function. The major difference between type 1 and type 2 diabetes. Type 1 is an autoimmune disease. Type 2 is the insulin resistance disease. And type 1 no longer produces insulin. But type 2 does not produce enough insulin or the body is resistant to it because the cells the insulin production does not stimulate the cell. And the beta cells have been destroyed in the type 1 condition because type 1 has the storehouse of insulin. In the case of type 2 diabetes, beta cells deteriorate over time. And the type 1 dependent on insulin for the rest of their lives, but the type 2 insulin injection may be required at some point. And the type 1 diabetes, and this is the type 2 diabetes in the bloodstream. The type 1 diabetes, there is no insulin production in the bloodstream. In the type 2, insulin is present in the bloodstream, but the cells do not recognize or stimulate or act with the presence of insulin. This is the type 2 diabetes. And this chronic hyperglycemic condition can be overcome by the maintaining of ideal body weight by providing adequate nutrition along with the normal blood sugar levels in blood. The diet plan for the diabetic is based on height, weight, age, sex, physical activity and nature of diabetes. The diet most often recommended is high in dietary fiber, and also they have to follow a self-management protocol. They follow monitoring blood glucose level, taking appropriate medication, following a meal plan based on ideal body weight, adequate nutrition, getting regular exercise, etc. And what is glycemic index? Glycemic index or GI index measures how carbohydrate affect our blood glucose level, helping to choose foods for good health. So the glycemic index is the measures of how carbohydrates affect our blood glucose level or helping the choose of food for good health. High GI glycemic index value of carbohydrate cause blood glucose levels to elevated condition, but low glycemic index or GI value, carbohydrates are digested and released slowly for sustained energy. What are the importance of carbohydrates in our body? We all know about carbohydrates as the main energy source of our body. It's providing fuel for most organ, our brain, muscles during exercise. So, the high glycemic index value indicate the elevated levels of blood glucose level, and the low glycemic index value indicate the decreased levels of glucose in the bloodstream. And so, some studies have shown that a low carbohydrate diet or low glycemic index diet. So, low carbohydrate diet is also known as low glycemic index diet may be an effective dietary management of type 2 diabetes, as both approaches prevent blood sugars from skipping after eating. Carbohydrate is easily digested than fat and protein. The rise in blood glucose after meal is due to absorption of glucose from a carbohydrate digestion and increase in production of glucose by liver. So, type 2 diabetes person always focus on the low glycemic index food than high glycemic indexed food. And also the importance of proper diet in a diabetic patient to provide adequate nutrition, to control blood sugar and lipids, to maintain ideal weight, less medication, to prevent complications. So they focus the following 5 points. Because the chronic hyperglycemic condition leads to some other illness such as cardiovascular, neurological, ocular and other recurrent infection. So, to provide adequate nutrition, it will helps to control blood sugars and lipid and always maintain an ideal weight. It will helps to less medication and it also helping to prevent complications. And in the diabetic persons, first to follow 55 to 60% of total daily intake of carbohydrate in their food, and they follow 10 to 50% of total daily intake of calorie, the percentage of protein, and the carbohydrate obtained from cereals, pulses, and the proteins from meat, pulses, legumes, milk, etc. They helps to reduce the blood glucose and lipids. So, they choose protein content food. And the fat also is 20 to 25% of total daily intake of calorie. A high saturated fat intake has been associated with the higher risk of impaired glucose tolerance and higher fasting glucose and insulin levels. And the fats are of mainly 3 types: saturated, monosaturated and polysaturated. And the saturated ghee, butter, coconut oil taken in small quantities. The higher unsaturated fatty acids from vegetable sources have been associated with reduce the risk of type 2 diabetes. So, the people with diabetes have twice the risk of developing heart disease. So, they should reduce the intake of saturated fat and cholesterol like meat and dairy products that are major source of unsaturated and monosaturated fatty acids. So, Fish oils also contain mono and polysaturated fatty acids. So they prefer this type of fatty acids in their diet. And the next is the dietary fiber. The dietary fiber have been shown to result. The many controlled experimental studies, the results showed it will helps to reduce blood glucose and insulin levels in people with type 2 diabetes. Increased intake of whole grain cereals, vegetables and fruits rich in dietary fibers are found to have a protective effect. The American Diabetic Association recommends that the diabetic person should eat high fiber diet. It has been shown that the foods with fibers such as fruits, vegetables, peas, beans and whole grain breads and cereals helps in lowering the blood glucose level. And also they should plan or follow a proper healthy eating plan that is high in nutrients, low in fat and moderate calories is needed. The major thing to keep in mind is to eat a balanced diet. The serving size and the type of carbohydrates one eat are especially important. So, the permissible foods are green leafy vegetables, soups, dairy products, fruits, especially apple, guava, pear, papaya, all pulses, etc. They should completely avoid sugar, jaggery, honey, potato, beetroot, sweet potato, RV, fried, canned foods, processed foods, soft drinks, ice creams and fruit juices. They should focus on high fiber complex carbohydrate, also known as slow release carbohydrate food. They help keep blood sugar levels because they are digested more slowly, thus preventing the body from producing too much insulin. They also provide lasting energy. And they also excessive intake of alcohol can increase the risk of diabetes by damaging the pancreas and liver and by promoting obesity. Also, alcohol can interfere with diabetes medication and insulin. Therefore, consumption of alcohol should be controlled or avoid. The role of exercise in preventing, controlling or reversing diabetic is crucial. So, proper exercise can help to lose weight if one is overweight and is especially important in maintaining weight loss. So, walking for 30 minutes 5 or more times a week, swimming or any other moderate intensity activity will be very effective. And also they choose vegetables, green leafy vegetables, high fiber foods and the food in moderate amount such as fat, nuts, cereals, fruits, milk products, eggs and completely they avoid sugar, sweets, honey, sweetened drinks, also alcoholic drinks, etc. And these are the important diet control pattern for the diabetic persons. Thank you. And the expected questions from this portion is the compare type 1 or the difference between type 1 and type 2 diabetes and what is diabetes mellitus. The next question is the chronic hyperglycemia. What is polyuria, polydipsia and the polyphagia and what are glycemic index and what are the major diabetic diet plan. to maintain ideal or to maintain controlling the diabetes. So these are the questions expected from the area. And another one is the what is dietary fiber and what are its importance. Okay, thank you. These are the important questions expected from the portion. Thank you.